Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about pain after knee replacement surgery, and particularly when might pain be a sign of something more than just the typical rehab and recovery. Before I jump into that, be sure to hit your subscribe button, turn on the notifications so you can catch all of our videos related to knee replacement surgery. So when we think about pain after a knee replacement, having pain is a very normal part of the rehab and recovery. And it can be intense at times, it can fluctuate, it can linger, it can last for quite a while. Unfortunately, these are just kind of the normal nature of the beast part of rehab and recovery after a knee replacement. Typically, that intensity is going to be pretty high early on after surgery. It can kind of fluctuate, but overall, we do want to see a trend that, over weeks, over months, that pain level is decreasing in intensity, it's decreasing in frequency over time. That's a sign that you're healing and you're recovering from your surgery. Now, if your pain is constant or starts to get worse with time, now we want to start looking at, is there something, one, that we have to look at your pain management. So do we have to look at if you're taking prescription pain medicine? Is this helping? Do we have to adjust it? Are you using other modes of pain management? Icing, heat, electrical stimulation, light stretches, elevation, things of that nature. Discussing that with your surgeon, with your physical therapist, your medical team, to make sure that you're effectively using multiple modes in multiple ways to stay on top of your pain and manage it effectively. Now, if you've looked at that and you're still having issues, then, when can we think that maybe something deeper is going on? Maybe there's a red flag of something more than just the normal rehab and recovery pain. And so some things to think about. Is the pain coming from somewhere else? Are you having pain because of an issue with your low back or an issue with your hips and your hip joint? Is it something from your foot and ankle? Sometimes we tend to get tunnel vision when it comes to pain and managing a patient after knee replacement surgery, and we don't remember that the body is an interconnected chain. So there may be issues at these other body parts that are leading to this pain that you're experiencing in your knee joint or around your knee joint. So making sure to address those other areas if that is appropriate. Now, certain times, we want to think something else might be going on. So some things to be aware of is the pain, is it a sudden increase? Is it a sudden new onset of pain? Or a sudden new onset of a very high intensity of pain? Or is it accompanied by other symptoms or accompanied by other symptoms? So you're having a new onset of pain, and you're also noticing that your knee is giving out or buckling, or you're noticing redness and swelling, increased stiffness of the knee joint, things like that. So let's talk about a few things that may be causes of pain and other symptoms and kind of red flags to be aware of. So one, early on after surgery especially, but throughout the course of your rehab, is a blood clot or a deep vein thrombosis or a DVT, which is a blood clot in your leg and your calf. And this is the biggest risk early on after surgery, like I said, but really can happen any time in the recovery. So some things to look out for is the pain is throbbing. The pain tends to be more in the calf and the calf muscle than in the knee itself. It's accompanied by swelling in the calf, a warmth of the skin around the calf, a kind of reddened or darkened area of your skin in the calf or on the calf, and maybe potentially some swelling of the veins. So these are all symptoms of a potential blood clot or DVT. If you are having any of these symptoms, again, definitely recommend consulting with your healthcare team to see if this is something worth taking a closer look, or it just is something of the normal recovery after surgery. Another risk factor is infection. So with an infection, usually the pain is sudden or a new onset, oftentimes accompanied by stiffness and swelling. You can also have some erythema or redness. You may also, if you still have a wound, you're early on after surgery and you still have the incision and the wound isn't fully closed, you may notice some drainage, increased drainage. You may notice some smell or some discoloration of that drainage. And you may have additional symptoms. You may have a fever, chills, night sweats, or just extreme feeling of fatigue. So if you have these symptoms or kind of a mixture of those symptoms, that may be a risk factor or maybe an indication of an infection. Some other things to think about is joint failure, so a loosening or a failure of your knee replacement. Again, this pain is sudden or a new onset usually, often accompanied by swelling, especially worse pain when you're weight bearing, so when you're standing, walking, going up and down stairs. And really you have this feeling of instability, feeling of the leg's going to give out, feeling of a buckling sensation. This might be an indication of joint loosening or failure of the knee replacement. And then unfortunately some folks after a knee replacement can experience persistent or chronic pain. And really this becomes a new animal or a new beast because acute pain or post-operative pain early on after surgery is really quite different than persistent or chronic pain. Chronic and persistent pain really has a lot to do with your nervous system, your nerves, and their communication with your brain. And how we manage and deal with persistent pain is a lot different than that early acute pain. A lot of it, management strategies, comes down to retraining your body and your nervous system and your brain to move and do things without pain. So a lot of this comes down to being active, being physically active, doing exercises, and doing them kind of in a slow and progressive buildup. Again, retraining your body that is hypersensitive and the nerves are hypersensitive. You may hear of cognitive functional therapy or cognitive behavioral therapy, which is a really common type of therapy that looks at persistent pain and the pain science of why people can have persistent or chronic pain in any circumstance, but also after a knee replacement, and how to manage that effectively and differently than acute pain or early post-surgical pain. And so taking a new perspective of pain and symptoms and management when it's persistent or chronic pain. Now just going back a step, when we talk about all these different symptoms, you might start to realize that there's a lot of overlap. So a lot of these symptoms can be just normal symptoms after a knee replacement. So really it comes down to triangulating. So looking at, if I'm having this symptom, am I also having these other symptoms? And also communicating with your physician, your surgeon, your physical therapist, and saying, look, I'm experiencing these things, these symptoms. They'll be better able to take a personalized assessment and say, okay, this warrants a closer look, or maybe this might just be the normal ebbs and flows and symptoms and pain after a knee replacement surgery. So I hope you found this video thorough and helpful and insightful. Please be sure to hit that subscribe button again if you don't already. Hit that like button to help spread this video. And as always, please leave your comments, your questions below as I try my best to get back to everyone I see. Thank you for watching.